purpose of the Anticipatory Care Calendar is to reduce health inequalities, ensuring everyone, no matter who they are, has the same access to health services. There is a legal requirement that people in supported living have good documentation kept about them and that outcomes are being met. It is up to you as providers to demonstrate this. By using the calendar, providers can clearly highlight that many of the required outcomes of quality and safety guidance are being met and recorded. Care pathways are visually easy to follow. They support carers by improving record keeping, making it harder for other health professionals to refuse to treat a client. Communication is also improved between care staff and the GP and other health workers. The calendar standardises documentation too, so all providers and day services within the area will now have access to the same pathways. The calendar also assists with picking up early symptoms, which reduces the crisis management that can sometimes happen. It's totally portable and can be taken to any appointment to show the problems that have been occurring and if there have been any recognisable patterns. The improved recording of cancer screening will also encourage increased participation in screening programmes for the people you care for.
If you support people that are eligible by age to attend screenings but are not currently on the recall system, it must be recorded. This is to be indicated in the box on the right-hand side. If you are not sure if the people you support are on any of the available screening programs, you should contact their GP to find out. To ensure the information recorded about the screening is up to date, your manager will need to sign the calendar. The calendar covers 12 areas of health, which include pain, bowels, urine, health observations including periods, lumps and bumps in certain areas, mouth problems, and seeing and hearing, weight recording, eating and drinking, sleeping, mobility and falls, behaviour, seizures, other symptoms, swallowing problems, and changes to skin. The calendar works on a traffic light system. Green boxes are to record normal. Amber requires an intervention, usually to encourage monitoring or to give painkillers if prescribed. And red indicates immediate action, as it is likely to be an emergency or an ongoing problem that has worsened. The calendar should be completed every day at the end of your shift, i.e. early shift or late shift. The night staff will only complete the sleeping section the following morning. Work your way through the relevant sections, putting your initials in the green boxes indicating no problems. Some sections have no green boxes, so these will only need completing if a problem has arisen that is specific. If there is a problem that has been picked up during your shift, for example an amber or red, the calendar will need completing for that problem immediately after dealing with the issue. This means you are recording observations every day, and over the calendar month, a picture of that person's health will be created. If there have been any problems during the day that another member of staff has dealt with, you will see them recorded within the calendar and on the significant communication sheet. To clarify the meaning of the descriptions, which are shown down the left-hand side of the calendar, a separate supporting document is used. These are known as the description and action sheets. You will need to use your description and actions alongside your calendar. If someone has had a change, for example their behaviour has altered or they seem to be in pain, you'll need to refer to the descriptions to first identify the severity and then follow the appropriate action that is shown. This information then gets documented on the significant communication sheet at the back of the calendar. For every amber or red action that is recorded, a significant communication needs to be completed, and it must detail what has changed. If several problems have occurred together, these can be recorded as one issue. All remaining sections must be completed, detailing what you have done as directed by the action sheet. An example could be contacting the GP for an emergency appointment. If so, ensure you highlight and document when the appointment is. You will need to complete the health professional action on your return from the appointment to ensure you have captured what has been discussed and complete the outcome when the problem is better. Evidence shows that outcomes are rarely recorded, so always ensure you return to the calendar to complete this section. If you've had to follow a red action, you must obtain your manager's signature at the first available opportunity. This acknowledges they are aware of the problem. The significant communication page offers good detailed communication, so staff on later shifts can see at a glance information for that person all in one place.
Thanks very much for coming this morning.
A baseline assessment sheet is a key element to the success of using the calendar. It needs to be completed by as many members of the team as possible, including your manager, and prior to the calendar being started. This details what is normal under each section. This will also assist new or agency staff that come into the home to better understand the people they'll be supporting. This would need to be reviewed every 6 to 12 months to ensure there has been no change. It's also important to keep the baseline assessment with the active months calendar to ensure that you're not recording something as a problem that is actually normal. An example of this would be someone who suffers from diarrhea 2 or 3 times a month. This matter would be recorded on the baseline assessment so that when a person has an episode of this nature, it can be recorded as normal. It would be recorded as diarrhea, but linked with an arrow to show normal. If further episodes of diarrhea were recorded that month, then appropriate action would need to be taken. For the anticipatory care calendar to function effectively, it's important to remember your checklist. There should be initials in each section every day and for each shift, even if there have been no reported problems. It's not for you to diagnose or assume, but to record any change and to follow the actions to the relevant services or professionals. The significant communication page is to be completed for each new amber or red problem, but not for normal status. And a manager's signature is required to acknowledge each red action followed and that screening information is up to date. The anticipatory care calendar prompts you to make observations and to act on any change noted on a daily basis, no matter how small.